The American Heart Association's systematic approach includes 3 components once you have established scene safety and your initial impression of the patient: the BLS assessment, the primary assessment, and the secondary assessment. These sequences combine assessment and treatment components for effective resuscitation. When deciding which assessment to use for a patient, start with a step we all do automatically: visually assess if the patient is conscious or unconscious. This is your initial impression of the patient. You can form a rapid general impression by a quick visual assessment of responsiveness, breathing, and color to determine the urgency of the situation. After determining the scene is safe, if the patient appears unconscious, use the BLS assessment. After completing all of the appropriate steps of the BLS assessment, progress to the primary assessment for more advanced assessment and treatment. Finally, progress to the secondary assessment. If the patient is conscious, go directly to the primary assessment and then the secondary assessment, which we'll review in a moment. For unconscious patients, you'll follow the BLS assessment. First, check for responsiveness. Tap and shout.
Are you okay?
If the patient is unresponsive, shout for help.
He's unresponsive, I need help?
Activate the emergency response system and get an AED or defibrillator. Depending on the circumstances, EMS providers may need to call for additional responders to assist with the patient. In some settings, the healthcare provider may assess the patient's breathing and pulse before activating the emergency response system.
Mark, start chest compressions.
Next, check breathing. Scan the chest to detect if breathing is absent or abnormal. Check for a pulse. Ideally, you should check breathing and pulse simultaneously. If you can't feel a pulse within 10 seconds, start high-quality CPR, beginning with compressions. If you determine the patient is not breathing normally but has a pulse, bypass chest compressions and support the patient by ventilating once every 5 to 6 seconds. As soon as possible, attach an AED or defibrillator and, if indicated, deliver a shock. High-quality BLS is the foundation for saving lives after cardiac arrest. If these steps are performed rapidly and well, the patient's chance of survival increases. In fact, the effectiveness of advanced life support measures depends on high-quality BLS. In some cases, BLS will result in ROSC, but sometimes cardiac arrest persists, requiring you to continue with more advanced, invasive measures. This is when you should follow the primary assessment and secondary assessment. Another time to use the primary and secondary assessments is if a patient is conscious. You can easily remember the steps of the primary assessment by thinking A, B, C, D, E. Keep in mind that, although these steps are listed in progressive order, the resuscitation team often performs them simultaneously. A stands for airway. For unconscious patients, healthcare providers should maintain a patent airway and consider inserting an advanced airway device. Regardless of the device chosen, the resuscitation team must ensure proper placement and use waveform capnography to monitor effectiveness. Conscious patients can often maintain the integrity of their own airway, and healthcare providers need only ensure patency by providing suctioning if needed. B represents breathing. For patients in cardiac arrest, provide 2 ventilations with the bag mask device after every 30 chest compressions. After inserting an advanced airway, healthcare providers should continue ventilations by providing asynchronous ventilations once every 6 seconds. If the patient is not in cardiac arrest, healthcare providers should assist ventilation as needed once every 5 to 6 seconds. If the patient does not require assisted ventilation, healthcare providers can support the patient by administering oxygen as needed. C involves supporting the patient's circulation. Attach ECG leads, obtain intravenous or IV access, or intraosseous or IO access. Give appropriate drugs to manage abnormal rhythms and assess for perfusion issues. You're collecting a wide range of information, including blood pressure, heart rate, and cardiac rhythm. Additional data, such as temperature and glucose levels, may further refine the initial interventions needed. The A, B, and C steps provide a continuous stream of information about the progression of the patient's condition. D stands for disability. This involves checking for neurological function. Quickly assess for responsiveness, levels of consciousness, and pupil dilation. A quick tool that can be used to evaluate neurological status is AVPU: alert, voice, painful, and unresponsive. Finally, E involves exposing the patient. Remove clothing to perform a physical examination looking for obvious signs of trauma, bleeding, burns, unusual markings, or medical alert bracelets. The secondary assessment involves the differential diagnosis. This involves obtaining a focused medical history and searching for and treating reversible causes. You may naturally jump to some possible diagnoses as soon as you evaluate the patient. However, before arriving at a definitive diagnosis, you'll need to assess the patient and gather additional information about the condition. Gathering a focused history of the patient is recommended. Ask specific questions related to the patient's presentation. Consider using the memory aid SAMPLE. Signs and symptoms, allergies, medications, including the last dose taken, past medical history, especially relating to the current illness, last meal consumed, and events, especially ones that may have led up to the current illness. The answers to these questions can help you quickly rule in or rule out suspected diagnoses. Next, look for and treat the underlying cause by considering the H's and T's to ensure you're not overlooking a dangerous or likely possibility. The H's and T's create a roadmap for possible diagnoses and interventions for your patient. Let's review these now. Hypovolemia is low blood volume. Hypoxia occurs when inadequate oxygen is reaching the body's tissues. Hydrogen ion, or acidosis, is the accumulation of acid and hydrogen ions in the blood and body tissues. Hyperkalemia is an abnormally high concentration of potassium ions in the blood. Hypokalemia is low blood potassium. Hypothermia is when the body temperature drops below 95 degrees Fahrenheit or 35 degrees Celsius. Tension pneumothorax results from an abnormal accumulation of air in the pleural space. Cardiac tamponade is a condition caused by an accumulation of fluid between the heart and the pericardium. Toxins may be best uncovered by a focused history. A pulmonary thrombosis, or pulmonary embolism, is a blood clot from a large vein that breaks off and travels to the pulmonary artery where it becomes lodged. A coronary thrombosis is a blood clot that forms within a blood vessel of the coronary system. Intervening and stopping a patient's downward spiral is the ultimate goal of the BLS, primary, and secondary assessments. The American Heart Association has developed a truly systematic approach that can facilitate optimal care. By following the assessments in tandem with an adherence to the chain of survival, you will more efficiently and effectively assess, diagnose, and treat your patients.